Welcome, welcome to the Healthy Reset. We want to thank you for coming on. Today, you're in for an empowering session. This session is the ultimate guide to cervical cancer screening. We are breaking down everything you need to know from the ideal screening schedule to understanding the key tests, like the pap smear. Here's why you should stick with us until the end. By the time we are done, you'll know exactly how often you should get screened, what each test means, and how a single affordable screening could protect your health for years to come. Plus, we'll tackle common questions and myths you might not expect. So if you're ready for a healthy reset that puts you in control of your health, stay tuned and you won't miss a thing. So we are dealing with cervical cancer tonight and breast cancer in honor of last month. There was cancer in this month, last month. So we want to deal with these two important topics. So we often hear the term screening when it comes to anything medical. What does screening mean? It is really and truly, it is the search for unrecognized disease or detect by means of rapidly applied tests or examinations or other procedures in an apparently healthy individual. Historically, it means the detection of hidden diseases. What this generally means is that screening is important because sometimes we are feeling as if we are well and you have no symptoms of anything and the disease is there in your body and is progressing. So hence the reason why you come in to your health facility, to your medical doctors, to your practitioners, and check to see how you are actually going. So in terms of cervical cancer, I want to give some statistics. Cervical cancer is the fourth most common cancer in women globally, with around 660,000 new cases and around 350,000 deaths in 2022 alone. The highest rates of cervical cancer incidence and mortality are in low and middle income countries. This reflects major inequalities driven by lack of access to HPV vaccination, cervical screening, and treatment services. Cervical cancer is caused by persistent infection with the human papilloma virus. Women living with HIV are 6 times more likely to develop cervical cancer compared to women living without HIV. Prophylactic vaccination against HPV and screening and treatment of precancer lesions are effective strategies to prevent cervical cancer. And they are very cost effective. Now, cervical cancer can be cured if diagnosed at an early stage and treated promptly. Countries around the world are working to accelerate the elimination of cervical cancer in the coming decades, with an agreed set of 3 targets to be met by 2030. So it is a serious issue among women all over the world. The causes of cervical cancer, as I said before, is the human papilloma virus, which is a commonly sexually transmitted infection, which can affect the skin, it can affect the genital area, and it can affect the throat. Almost all sexually active people will be infected at some point in their lives, usually without symptoms. In most cases, the immune system clears the HPV from the body. However, persistent infection with high-risk HPV can cause abnormal cells to develop, which can go on to become cancer. Persistent HPV infection of the cervix, which is the lower part of the uterus, or what we know as the womb, which opens into the vagina, also called the birth canal. If left untreated, 95% of cervical untreated causes 95% of cervical cancers. Typically, it takes 15 to 20 years for abnormal cells to become cancer. But in women with weakened immune systems, such as untreated HIV, this process can be much faster and take at least 5 to 10 years. Risk factors for cancer progression include the grade of HPV type, the immune status, the presence of other sexually transmitted infections, the number of births experienced by women, young age of your first pregnancy, hormonal contraceptive use, and smoking. So you are saying with all these statistics here that I just gave, what can we as women do to prevent this dangerous disease? One of the main forms of prevention is what I'm doing here now, which is boosting public awareness. Access to information and services are the key to prevention and control across the life course. Being vaccinated at age 9 to 14 years is a highly effective way to prevent HPV infection, cervical cancer, and other HPV-related cancers. Screening from the age of 30 with HIV can detect cervical disease, which, when treated, also prevents cervical cancer. At any age with symptoms or concerns, early detection followed by prompt quality treatment can cure cervical cancer. So cervical cancer is quite curable when found early enough before it spreads to organs, to muscle tissues, and starts to what we call metastasize, spread across the body. As of 2023, there are 6 HPV vaccines available globally. All protect against the high-risk HPV types, which are type 16 and 18. These are the high-risk HPV types, which cause the most cervical cancers and have been shown to be safe and effective in preventing the HPV infection and, in turn, cervical cancer. So as a priority, HPV vaccines should be given to all girls age 9 to 14 years before they become sexually active. And that is the key here, what would protect them for their whole life. So once they get at an earlier age, or at an age where they haven't started to become sexually active, it is most effective. So that is the age they recommend is aged from 9 years to 14 years before they become sexually active. The vaccine may be given as 1 dose or 2 doses, as in some countries like Trinidad and Tobago. It is given in 2 doses, 6 months apart. People with reduced immune systems should ideally receive 2 to 3 doses. Some countries also have chosen to vaccinate boys to further reduce the prevalence of HPV in the community and to prevent cancers in men caused by HPV. So what they suggest generally is you get the vaccine from age 9 in women and to up to 27 years. And it used to be 9 to 45, but there's a new protocol now, and they're saying now it's from 9 years to 27 years in the female, and the same for the boys, 9 to 27. Other important ways to prevent HPV include being a non-smoker or stopping smoking, using condoms, and voluntary male circumcision. Women should be screened for cervical cancer every 5 to 10 years, starting at age 30. However, in Trinidad and Tobago and in a lot of countries, they screen every 3 years. Until that protocol has come here, we go with every 3 years here. Women living with HIV should be screened every 3 years, starting at the age of 25. The global strategy encourages a minimum of 2 lifetime screens with a high-performance HPV by the age of 35, and again by the age of 45 years. Pre-cancers really cause symptoms. So many times women are in the precancerous state and they have no signs or symptoms of the cancer. So we want to know you are precancerous and what treatments are available for that stage of the cancer. Treatments of precancers are quick and generally painless, causing infrequent complications. Treatment steps include colposcopy or visual inspection of the cervix to locate and access the lesion. And this is done either in a clinic, hospital, doctor's office with the use of the colposcopy machine. You go in, the doctor goes in with the use of just as if you're going to do a pap smear, and you open you up, they highlight the areas that they suspect. They use solutions and highlight the area, and after cleaning it with normal saline, it is highlighted with the vinegar, and it comes out white on the screen. So there's a screen in the room as well, and they take what we call a biopsy, right? Small pieces, put it in a solution and send it to the lab to get tested, right? So that is one of the first things that is done when you do a pap smear and it comes back abnormal. That is one of the first things that is done, so that they would know what stage is it at and how they are progressing to treat the disease. There is also thermal ablation, which involves using a heated probe to burn off cells as well. There is another step that is taken as well. It's called cryotherapy, which involves using a cold probe to freeze the cells off. These are just different ways of dealing with the cancer that according to the stage it's at. Then we have the LETS, which is the large loop excision of the transformational zone, which involves removing your abnormal cells with an electronically heated loop. And also we do something called a cone biopsy, which involves using a knife to remove a cone-shaped wedge of tissue. Now, these lower, the ones that I've done here, like the LETS and the cone, is done under anesthetic. So you will not be up to have that done, in case you were wondering, right? So early detection and treatment of cervical cancer is very important. What cervical cancer can be cured if diagnosed and treated at an early stage of disease. And therefore, recognizing the symptoms and seeking medical advice to address any concern is a very critical step. Women should see a healthcare professional if they notice unusual bleeding between periods. So your periods are finished and there's bleeding starts again, right? And I'm not talking about I'm talking about women who are not perimenopause, before menopause, you're getting this symptom as well. Now, after menopause has passed and you start to bleed, it's something of concern again. We may look at that as a red flag. So it is something that you should come get checked, get a pap smear done to make sure it's not related to cervical cancer. If you, after intercourse, even during intercourse, you notice bleeding, it's another red flag. Come get yourself screened, come and have a pap smear done to note if it's cancerous or not, if it's a hormonal problem or something like that. If you've noticed you have increased or a foul-smelling discharge, come and get checked out. Have a pap smear done, have your doctor, go to your doctor, your gynae, let them see what is the issue. Other symptoms to look at are symptoms like persistent pain in the back area, pain in the back, legs, or pelvis area, around the hip area. Weight loss, sudden weight loss, you're not on a diet, you're suddenly losing a whole set of weight. Fatigue, you're always tired. And then loss of appetite is another sign as well. Vaginal discomfort, particularly during sex as well. Even if you're not having sex, you're feeling there's this heaviness, this discomfort, unusual feeling. Your body gives you a sign when things are not right. So it is good to listen to what your body is telling you. And then swelling of the legs, just like that, your legs are swollen, they are swelling, right? This is another sign. So these are the things to look for in case you are querying if you may have cervical cancer or precancerous symptoms. As I said, not everybody shows symptoms, so it is good to have your screening done as often as is necessary. Again, I want to go over some of the symptoms women should you may be having, that you would be noted that you go to see a healthcare provider. Again, unusual bleeding between periods. Those are women who may not be in perimenopause or menopause. You're bleeding, a period has finished and another period come, heavy bleeding, get that checked out. After menopause, after menopause, 12 straight months after that, bleeding has ceased, you are going good, and then you notice that you start to bleed again, get that checked out as well. After sexual intercourse, you notice you're bleeding, or sometimes some women bleed during intercourse, and afterwards, get that checked out. Increased or foul-smelling vaginal discharge, get yourself checked out again. Symptoms that persist, like pain in the back, in your legs, in your pelvis, weight loss that you know you're not on a diet or anything like that, you're not on a special program, and you're just losing weight rapidly. Fatigue as well, you're always tired for no particular reason, not even exerted, doing anything, you're just tired, listless, you're not anemic. As far as you know, you're just this fatigue, this persistent fatigue, as well as loss of appetite. Apparent loss of appetite, you have no appetite for food or anything like that. That's another sign to get yourself checked out. Vaginal discomfort, even during sex, you would find that you're uncomfortable. Outside of sex, you're getting this uncomfortable discomfort. Get yourself checked out. And swelling in the legs. These cervical clinical evaluations and tests to confirm the diagnosis are very important and will generally be followed by what we call a referral service. So once you get the results, you'll be referred to get the care you need to deal with the issue, which may and can include surgery, radiotherapy, and chemotherapy as well as palliative care to provide supportive care and pain management. Management pathways for invasive cancer care are important tools to ensure that patient is referred promptly and supported as they navigate the steps of their diagnosis and treatment decisions. Features of quality care include a multidisciplinary team ensuring diagnosis, staging, testing, pathology, imaging takes place prior to treatment decisions. Treatment decisions in the line with national guidelines and interventions are supported by holistic and which deals with psychological, physical, and palliative care. Because remember, getting a diagnosis like cancer, you would need all the support you can get, whether it is spiritually, psychologically, palliatively, physically. All of these come together to help you to progress in a positive way through this stage of your life, of anybody's life who they may be having a problem or may have this issue. It is important to note that the WHO, the global strategy, defines elimination as reducing the number of new cases annually to 4 or fewer per 100,000 women, and sets 3 targets to be achieved by the year 2030. To put all countries on the pathway to eliminate in the coming decades. Now, a little more statistics here. 90% of girls vaccinated with the HPV virus by age 15, 70% of women screened with a high quality test by age 35 and 45, and 90% of women with cervical disease receiving treatment. These are the goals, so that we could reduce the worldwide problem or the worldwide diagnosis of cervical cancer. So ladies, as I said, awareness, education is the key to beating this issue. We want to now turn to breast cancer. Again, I want to give an overview, some key facts, and all of these information I'm getting from is from the WHO, along with what my experience is as a sexual health nurse. So key facts: breast cancer caused 670,000 deaths globally in the year 2022. Roughly half of all breast cancers occur in women with non-specific risk cancers other than sex and age. Breast cancer was the most common cancer in women in 157 countries out of 185 in the year 2022. Breast cancer occurs in every country in the world. Men get breast cancer too, but at a much lower rate. Approximately 0.5 to 1% of breast cancers occur in men. Now, breast cancer is a disease in which abnormal breast cells grow out of control and form what we call tumors. If left unchecked, the tumors can spread throughout the body, what we call metastasize, that is spreading, and breast cancer cells begin also, it is important to note, breast cancer cells begin inside of the milk ducts or the milk producing lobules of the breast. The earliest form, what we call in situ, is not life-threatening. That's very early and can be detected in early stages. Now, a lump in the breast can be as small as a pea, what we call a peas. Could be small as a peas, even small as a split peas, and it can be as large as a golf ball. So what I tell women, get to know the feel of your breasts. If you know how your breast feels on a regular basis, you would know if anything abnormal is forming in your breast tissue. So women who are on their cycles, who still seeing their periods, 5 days after, check your breast to find anything that may be unusual. You wouldn't do it during your period because we know we put on water weight and the breast tissue is not the way it usually is. It usually feels different than when you are not seeing your monthlies. So for women seeing their periods 5 days after your period, you could check your breasts, and I'll let you know how to do that. Women who are post-menopause, menopausal, your periods are not coming regular, you just set a date on your calendar in which you check your breasts on a regular basis. So let's say it's on the 27th of the month, every month, you check your breasts for anything abnormal. Starting with under the arm, because that is the tail end of your breast. And I want you to see your breast as a clock. Top part of your breast, 12 o'clock, the lower part, 6, and then we count in 1, 2, 3, 4, 5, 6, and then 7, 8, 9, 10, 11, 12. So if you go to the physician, you go to the clinic, and they ask you, where did you feel the lump? You could say, I felt it at 6 o'clock, or I felt it at 9 o'clock. And you're looking for other things on the breast, like what we call the typical orange peel look, you know, that lumpy, rough feel on the breast. That depends on the stage of the cancer as well. You're looking for if your nipples are not naturally, some people have inverted nipples, but if your nipples are usually the out and you start to invert, that is something to be of concern as well. If you squeeze the nipple, it's inverted, you squeeze as well, and you're seeing fluid, unusual fluid, which you're not supposed to have at this time. You're not breastfeeding or anything like that. You see fluid coming out of the breast. So these are some of the things you look at when checking your breast. So you raise one arm and you start underneath the armpit and you make rounded movements. You could use 2 fingers, 3 fingers, your index, middle, and the 3rd finger, or some of us use the first two, but to me, the three fingers works the best. And you make rounded movements from under your arm, then you start around the breast in a clockwise position until you reach to the nipple, and then you squeeze to ensure there's nothing coming out there. And you note, so if you find anything unusual, you come to the clinic, you come to the hospital, you check your gynae, your health center, you get that checked out to ensure that it's not what you may fear. Now, I want to let you know, not every lump is cancerous. Sometimes there may be a cyst developing there, yeah, and you're getting issues with that. So it doesn't necessarily mean that every lump is cancer, but it is important that you get it checked out to ensure that it's not, right? And if it is cancer, you get it checked, and the earlier, the better. So get it checked early to make sure you get your survival rate is much better. So that is how you check your breasts. Now, in terms of what I was saying earlier, the cancer usually starts in the what we call the milk producing ducts of the breast. And cancer can spread into nearby breast tissue if left or doesn't know you don't know it's there. This creates what we call tumors, which cause lumps, and it causes thickening, that thickening of the skin that I talked about earlier, which is the orange peel look, the orange peel feel, the orange peel look. It is very lumpy, bumpy on the top of the skin. Invasive cancers can spread to nearby lymph nodes. And we know once they reach by the lymph, it reaches the lymph, it spreads to organs, which we call metastasizing. Metastasizing can be life-threatening. So the earlier we find it, the better. Treatment is based on the person. It is based on the type of cancer and its spread. Treatment combines surgery, radiation therapy, and medication. Who is at risk for breast cancer? Approximately 99% of breast cancers occur in women and 0.5 to 1% in men. As I said earlier, the treatment of breast cancer in men follows the same principles as is of women, the same management. Certain factors increase the risk of breast cancer, including increasing age, obesity, harmful use of alcohol, family history of cancer. So you may have in your family many relatives who have had some people passed with the virus, with the cancer, and in your family it may be more prevalent. You to check yourself more regular because you've seen it in the family, right? A history of radiation exposure. For whatever reason, you might have had treatment with radiation previously, had cancer previously, and in some cases they come back. So the radiation exposure is another factor that may make you more at risk. Reproductive history, such as the age the menstrual periods began and the age of the first pregnancy. Tobacco use and post-menopausal hormonal therapy. Now, a lot of women, some women opt to get post-menopausal therapy to deal with the symptoms of menopause, and that itself is a risk of getting breast cancer as well. Approximately half of breast cancer develop in women who have no identifiable cancer risk factor other than gender, meaning that you're female, and over the age of 40. So not necessarily you having a family history of cancer means that you will get it, but it's also important that you get screened And it could be that your family don't have high risk for cancer, and you may still get it. So it is important that you do your self-checks, and any lump, bump, anything that you find abnormal, get it checked out. Family history of breast cancer increases the risk of breast cancer, but most women diagnosed with breast cancer do not have a known family history of the disease. That is important to note. Most women diagnosed with breast cancer do not have a known family history of the disease. So lack of known family history does not necessarily mean that a woman is at reduced risk. Certain inherited high penetrant gene mutations really greatly increase the risk, which the most dominant being mutations in the genes BRCA1, BRCA2, and PALB2. Women found to have these mutations in these major genes may consider risk reduction strategies such as surgical removal of both breasts or chemo prevention strategies. I've known women who were diagnosed with these mutations, and before the cancer show up, they had their breasts removed. Some women do that, so no problem, they don't mind, and they get it done because they have the genes that would eventually show up. Some women do that. So most women will not experience any symptoms when the cancer is in the early stages, hence the importance of early detection. Breast cancer can have a combination of symptoms, especially when it is more advanced. Symptoms of breast cancer can include a lump or thickening, often without pain, change in size, shape, or appearance of the breast. So when you're checking your breast as well, it's important that you lean forward, and when you're doing a self-check to see the size, we always note that one size is a little bigger than the other, but if you're seeing an extremely big difference between the size of one breast to the next, that is another sign that you should get your breast checked out as well. Change in size and shape and appearance of the breast. Dimpling, that is caused by what I was talking about, the orange peel look. It leaves a dimpling effect. Dimpling, redness of the breast, pitting, or other changes in the skin. Just as I said as well earlier on, change in nipple appearance, also the skin around the nipple, which is what we call that darker part around the nipple, which is the areola. You're seeing unusual changes in the skin color, the texture as well, and then abnormal or bloody fluid coming from the nipple. So you squeeze the nipple, you do your self-check, you squeeze the nipple, and you're seeing unusual, abnormal, bloody discharge coming from the nipple. People with an abnormal breast lump should seek medical care, even if the lump does not hurt. It is important. So some women check themselves and say, well, I'm feeling this lump, but it's not painful, so I think I'll leave that. It's not the best way to treat this problem. Get it checked out, because lack of pain doesn't mean that it's not cancerous. Most breast lumps, and it's important to note, are not cancer. Breast lumps that are cancerous are more likely to be successfully treated when they are small and have not spread to nearby lymph nodes. Breast cancers may spread to other areas of the body and trigger other symptoms. Often the most common first detectable site of spread is in the lymph node area, which is under the arm. Although it is possible to have cancer-bearing lymph nodes that cannot be felt. That's very, so that happens at times. Over time, cancerous cells may spread to other organs, including the lung, if not treated, the liver, the brain, and eventually the bones. Once they reach these sites, new related symptoms such as bone pain or persistent, consistent headaches would start to show up themselves. Treatment for breast cancer depends on the subtype, as they say, of the cancer and how much it has spread outside the breast to the lymph nodes, which, for example, for stage 2 and 3, or other parts of the body, which that might be a stage 4 diagnosis. Doctors combine treatments to minimize the chances of the cancer coming back, which we call a reoccurrence. And these treatments include surgery to remove the breast tumor, radiation therapy to reduce the risk of the breast recurrence risk in the breast and the surrounding tissues, medication to kill cancer cells and prevent spread, including hormonal therapies, chemotherapies, or targeted biological therapies. Treatments for breast cancer are more effective and better tolerated when started early, when the cancer is caught at the very early stages. Surgery may remove just the cancerous tissue, which is called a lumpectomy, or the whole breast, which we call a mastectomy, for those who are not accustomed with these terms. So you remove the lump. If that cancerous lump is removed, it's called lumpectomy. If the whole breast is removed, it's called a mastectomy. Surgery may also remove lymph nodes, right, which make the cancer more accessible to other parts of the body, because we know we have lymph nodes all over. So if they remove the lymph nodes, it is less, it weakens the cancer ability to spread all over your body. Radiation therapy also treats residual microscopic cancers left behind in the breast tissue and or lymph nodes, and minimizes the chances of cancer recurring on the chest wall. So these are some of the treatments, or the main treatments, that occur when diagnosed with breast cancer. I would like to also let you ladies know that we have our clinic is open and running. We do breast exams, we do pap smears. So, those of you who know that you're not up to date, it's important that you get yourself checked out, have your breast checked on a regular basis, whether you have the family history of cancer in your family or not. And as I said before, sometimes, in most cases, you don't have a strong family history of breast cancer, and you may want to be diagnosed with breast cancer. Cervical cancer, it makes it very survivable. Have your pap smears done. Our clinic does pap smears. We do, as well as we do breast exams. We teach you how to do your self-checks and what to look for as well, so to have your checks done. So in honor of last month, which was Cancer Awareness Month, the month of October, we did this program to further enlighten us, women, or educate us in the importance of getting screened for cervical and for breast cancer. So the floor is open now. I myself are specialized in doing breast exams and doing pap smears and making referrals as and if and when necessary. So I will be able to answer any questions you have once it's within my knowledge and scope, right? So anybody has any questions, if you know you haven't done a pap smear in a while, well, you can, and you don't want to wait for long periods of time in the hospital setting, we are here, we are willing, and we are ready to do your test.
Good night, everyone. Maria, I wanted to know what is in Trinidad and Tobago, is there a wide range of options and support for women who may have had a mastectomy?
As far as I know the only place basically I know is the Cancer Society. There may be other places, other outlets. I know St. James has a very good clinic as well, very, very good. And those are the basic two that I know of. There are more, but those are the two that I could think about on the forefront right now.
Okay, thank you.
You're welcome. Any other questions? I hope you all took note of the key points that we made, and if you know that you may have an issue or you may be afraid, fear would not be the best thing to hold you back from having yourself checked, because the longer you wait to check, you're putting your life at risk for whatever your body may be dealing with. It may not be cancer, as we say, but it could be something else your body is dealing with. So get yourself checked out. Get yourself checked. You're feeling anything unusual, whether it's being in your breast or in the cervical area, the signs and the symptoms, ladies, get yourself checked.
I have another question. Well, while performing pap smears at the health center, one of the clients asked, well, of course, I know the pap smear just detects cervical cancer, and she was concerned about any cancer higher up in the uterus, ovaries, and so. Those signs and symptoms you mentioned for cervical cancer, is it sort of similar for any type of cancer within the female reproductive organ there, or?
No, remember it could be related to, as well as, remember, talk about bleeding during menopause. And a lot of times when bleeding occurs in menopause as well, it could be a sign of endometrial cancer. That is cancer actually in the womb area, right? So if they don't find, they go check, a woman is postmenopausal, but she finds she's having bleed, they will actually use a pipelle, which is a tube that goes up into the endometrial area, and take those cells from there through a kind of suction process. It's a bit painful, because I have had that test done already, and those cells are taken to the lab to check if it's anything to do with the endometrial area, because after menopause, there's not supposed to be that thickening of the endometrial area to cause bleed, because remember, you're past that stage. So it puts the red light on endometrial cancer.
Okay, thanks.
You're welcome. Any other question, ladies? So if there are no other questions, I would like to tell you all, everybody, thanks for coming. I want also let you all know again that our clinic is open and running, so you can also contact us if you want to get back your results at a quicker pace. Within a week, 2 weeks for the most, you get back your results, and you are referred, if necessary, to the necessary places to get further treatment. Dr. Khan, you would like to say anything at this moment before we close off?
Hey everyone. And one of the things that Maria didn't mention was she has installed
Oh, yes.
Beautiful,
I forgot.
nice, comfortable examination bed specifically for you ladies to have the best comfort while having your pap smear done.
I
And
forgot.
and we are the first nurse-led women's clinic. So it's women helping women. And so we try to create as much comfort for you as possible so that you can have a great experience while having your pap smear, breast examination, and other tests done. All right, so come to our clinic. Book your pap smears if you have one due by the end of this year or the beginning of next year. We always recommend do it in the beginning or the end of the year so you can repeat it yearly and you have that record here. Come in, do it with us, and let's get you on the right track either before the year starts or in the new year. So give us a call and we'll organize an appointment for you. All right. That's it for me.
Thank you, Dr. Khan. So thank you, ladies. Thanks for the questions. Thanks for the interest. And I would like to say that any topic that you all think that we should get into that may be concerning to any of you, you could also drop that in and we would deal with them accordingly. Because, you know, we have varied issues during menopause. Everybody wouldn't be having the same symptoms or issues. So we want to make sure that we could reach a wide range of topics. We do a wide range so that we could cover everything that everyone may be going through. So thanks again for coming tonight, everyone. Hi, good night.